Ready? Okay, we're ready. Our live stream is happening in Sacramento. Good evening, everybody. Thank you so much for coming to this important conversation about healthcare. Thank you, Assemblyman Addis, for making this happen. Really appreciate it. My name is Shelley Higginbotham, and I am with the League of Women Voters, and we're here to assist in facilitating tonight's conversation. I have a question sorter here, I have a timer, and a young woman out there taking your questions. Couple little housekeeping. Please silence your cell phones. It makes it very difficult for the panelists to answer. Our exits are over there, and there are bathrooms just beyond the stairs if you need to use the restroom. So, a little bit of how it's going to go tonight. I'm going to introduce our panelists, give a short bio about them. Assemblymember Addis will come up and give a legislative update. And then we have questions that came into the Assembly member's office that we'll ask the panelists. And 5-6 minutes doesn't quite seem long enough to answer important questions, but we're really hoping to get through as many questions as we can that came in ahead of time, as well as those of you that took the time to come tonight and ask your questions. So we'll do the best we can to get as many questions answered as possible. So there we go. Here we go. We have 3 panelists. Our first panelist is Assemblymember Dawn Addis. She was elected to the California State Legislature in 2022. She represents the coastal 30th Assembly District, covering parts of San Luis Obispo, Monterey, and Santa Cruz counties. She chairs the Budget Subcommittee on Health and serves on the Budget, Education, Health, and Insurance Committees. She is the inaugural chair of the Central Coast Legislative Caucus, a vice chair of the Jewish Legislative Caucus, and a member of the Women's Caucus. You're very busy. During her tenure, she has fought for critical investments and policies, securing millions in state funding for local projects, passing key legislation on healthcare, environmental protection, consumer rights, and public safety. She has authored bills to increase transparency in utility rates, strengthen protections for vulnerable communities. She was a teacher for over 20 years. She holds a Master of Arts in Special Education from San Francisco State University. She has a teaching credential in elementary education, secondary education, and special education. And additionally, she's fluent in Spanish. So let's give our Assembly member a nice hand. Our next panelist is Dr. Renee Bravo. Dr. Bravo is a primary care pediatrician on California's Central Coast and founder of Bravo Pediatrics. He is the president-elect for the California Medical Association, I think the first from San Luis Obispo County. He has extensive leadership experience, including serving on multiple boards and committees. He has been active in local health care for decades, including medical staff roles at Sierra Vista Regional Center, which is now Adventist Health, leadership in San Luis Obispo County Medical Society, and founding the Children's Health Initiative of SLO County. Dr. Bravo has also served 20 years, I'm going to get this word wrong, you might have to help me, Dr. Bravo, with the U.S. Pharmacopeia Convention. How'd I do? Okay, thank you. Including as its president, and has held various advisory and commission roles focused on health policy and access. A UCSF medical graduate, Stanford-trained pediatrician, and he notably ran for the state assembly in 1998 to promote physicians' voices in legislation. Let's give a warm applause for Dr. Bravo. Our third panelist is Dr. Ideen Nazmi. Dr. Nazmi trained at UC Davis, the London School of Hygiene and Tropical Medicine, the Federal University of Pelotas in Brazil, and the University of Michigan School of Public Health. His experience includes service as a U.S. Peace Corps volunteer in the islands of Micronesia, leading community health programs in Caracas, Venezuela, studying the Brazilian universal healthcare system, and more than a decade of consulting. Locally, Dr. Nazmi has served our community as a frontline epidemiologist during the COVID-19 pandemic, a community board member for Adventist Health Central Coast, and a member of the California Governor's Science Advisory Board. He is a German-born Azerbaijani Iranian and formerly undocumented U.S. immigrant. Please give a warm applause for Dr. Nazmi. So the first item on our agenda will be a legislative update on health care for Assemblymember Addis.
Well, first and foremost, I want to say good evening and thank you all for joining us. This is actually the first ever town hall style event that we have done since I was elected to office in 2022. And so it was really important to me to do it on healthcare, knowing how important healthcare is to the Central Coast. I want to thank our panelists, Dr. Bravo and Dr. Nazmi, and just say how grateful we are for both of you for joining us. We wanted to make sure that we brought to the community experts that could answer the most important and salient question that I think is on everyone's mind, which is how do we move out of being a healthcare desert here in San Luis Obispo? I think it's the thing that I talk about most in healthcare in Sacramento, the thing that I get asked most, and the thing that people sent us most when we were putting this together is, why is this a healthcare desert and what do we do about it? But there's a lot going on, and there's a lot of other wonderful people in the room. I know that we have our CHC, our health clinic director here. We've got somebody from the California Department of Public Health that is joining us in the audience tonight. We have representatives from Congressman Carbajal and Congressman Panetta's office, and we're so grateful for the both congressmen's leadership in DC. We'll talk a tiny bit about the effects of DC on California. There are local electeds here and local leaders, as well as healthcare providers and professionals. And if you could also please give a round of applause and a thank you to the League of Women Voters for helping us this evening. If you don't know the League, they are the single most important organization, in my opinion, when it comes to public discourse and public engagement and bringing the community together in a constructive way to engage in conversations like these. So we're elated that we're here. With them, that they are supporting this event tonight. But how I came to this work is I've lived on the Central Coast for 25 years. We've lived in Morro Bay, raised our 2 kids there. I'm the daughter of a nurse, but the mom of an aspiring doctor. So I've got healthcare on either side. And I taught in our local schools, as you've heard, for over 20 years, primarily with students with special needs and students that were interfacing with the medical system. And so know the challenges that many in our community face. And as I mentioned, we live in a healthcare desert, and it was apparent when I moved here 25 years ago what we faced. But as we've heard from all of you, it feels like it's gotten worse and worse. And we're not alone. There's 5.9 million people. We have 40 million people in California. 5.9 million people live in areas that lack enough primary care doctors to meet their region's needs. And so when I got to the legislature, I knew that healthcare was going to be a focus of mine. And I was very honored when the Speaker of the Assembly, who's sort of like the Nancy Pelosi of California, appointed me as chair of what's called the Subcommittee Number 1 on Healthcare, which is basically the committee that oversees the healthcare budget in California. And it doesn't sound very exciting, but actually it's a $200 billion budget that we oversee for the state of California, and we interface with all of the departments that are governing healthcare in California. And so I requested that specifically because of my experience here on the Central Coast. You may not know this, but we are the fourth largest economy in the world now. However, we have one of the highest rates of poverty and peoples whose needs are not being met of anywhere in the United States. And so we see this on the Central Coast all of the time, actually a stratification of very, very wealthy and also folks that are really struggling. And of course, healthcare is one of those major issues. So right now we are in the budget process, and I just want to tell you a little bit about that because I'm sure you're hearing on the federal side about Medicaid, Medicaid, Medicaid. On the state side, we are also dealing with budget issues. We're facing a $12 billion deficit this year, and we are going to experience cuts when it comes to really important services. And so we have held, my committee as well as the full budget committee has held 11 different hearings this year to hear from many, many different voices about what's happening. But three of the most important are how do we increase providers? What can we do in that area? How do we protect the gains that we have made? California actually has 94% of our population now has health insurance, which is historic and an amazing amount of progress for anywhere in the United States. So how do we protect those gains? And then how do we reduce costs? And California actually has the Office of Healthcare Affordability working on lowering costs, and we may get into some of those details. So the governor put out his January budget, and then the devastating LA wildfires happened, and that sort of threw the budget into havoc. And then we had a new federal administration that is also wreaking havoc both at the federal level, but also on our California state budget through tariffs that finally the courts just decided that those tariffs are not legal, through very strange economic decisions that affect the California tax base in detrimental ways. So we are kind of reeling from all that is happening as we try to make progress. And the governor just put out what's called the May Revise, which is his new sort of updated version of how he sees the balancing of the budget. And now the legislature has time to react to that. And so we are working nonstop night and day. And again, most of the cuts that are being proposed are coming in healthcare. So I am in very much a protective mode of how do we protect what we have here in California, as well as make progress for the Central Coast. So I want to say thank you. I want to leave you with just one thing. You know, I mentioned Congressman Carbajal has been a huge champion, and Congressman Panetta has been a huge champion for us. I was just with another congresswoman that I sort of overlap with in the Monterey area, Zoe Lofgren. She's chair of the California Democratic delegation. And, you know, she came to us very, very concerned and is also fighting. And so I wanted to recognize the good work that our representatives are doing in Congress to try to stop what is happening, whether it's the rollback of subsidies to covered California or cuts to reproductive care through Title X, restrictions on vaccine access, or cuts to our local public health departments. Those folks are really fighting at the federal level where they're in the minority. Here in California, I'm in the majority, and so we are having different kinds of conversations, but nonetheless very challenging. And it's why I wanted to host tonight, was to hear from the community as we go into budget negotiations, to hear what else is on your minds so that I can go back to Sacramento and uplift your voices in Sacramento. So excited for our panelists. I won't take any more time. We have a very packed agenda. We are live streaming, and we have some folks that came down from Sacramento specifically to live stream this, and it'll be available later if you miss anything. But thank you for being here, and we'll turn it back over to League of Women Voters, to Shelley, to get us started with the information portion. Thank you so much.
So the way we're going to start is I have some questions that came from the Assembly member's office, specifically to Dr. Bravo and Dr. Nazmi, and then to the Assembly member, and then a few questions that came in through the website. And then we're trying to reserve 20-25 minutes for questions from the audience. If your question doesn't get asked, make sure you get them to us and we will hand them off to the Assembly member's office, and hopefully we can get some answers for you. So bear with us here. So Dr. Bravo, you're up to bat. So you can stay there if you'd like. Your choice.
Okay. I think I'll stay here. This is fine. First of all, good evening, and thank you for coming. And before I start, I just want to acknowledge Assemblywoman Addis, the leadership that she's shown in Sacramento. Her voice is unique because she has walked the walk in advocating for children with special needs and for advocacy for her constituency. And so we're proud of you, and thank you. Thank you very much. Renee Bravo, that's me, pediatrician. I've been a physician here on the Central Coast for almost 40 years, and I come to you tonight not as the president of the president-elect of the California Medical Association, but as an advocate for children, and most importantly to me, a former child who was on Medi-Cal way back in the 60s when my parents lost their job. So for me, this is profoundly personal, and we are living in a time where there's a lot of challenges being made to the progress I think we've had in California over the last 30 years. And one of the things that I find encouraging is that people are stepping up and they're saying something, and they're starting to see that their voices are important and do matter. But let me give you some numbers about SLO County, because this is important to know. Medi-Cal, and I'm going to speak to people right now. I just want to take a moment. You don't have to raise your hand, but if you are a patient on Medi-Cal or have a loved one on Medi-Cal or know of someone on Medi-Cal, I'm speaking to you right now. You're cared about a lot. We're working our tail off to help to preserve what we have, and we're not going to go quietly in the night. I want to pledge that to you. That's important because I want you to hear that. But Medi-Cal in San Luis Obispo County, there's about 78,000 people who use Medi-Cal or SenCal as we have it here. About half of those are children between the ages of 0 and 18. It's about 50-50 male, female. And the budget for Medi-Cal in San Luis Obispo County is about $800 million. So it's not a small penny. And the threats to the Medi-Cal system, that's Medicaid for those at the national level, are significant in that we've seen proposed cuts now coming down, and now it's in the Senate's hands to reconcile this. They have a very much milder version, but it's really important now that we get that out. And how I've seen it change throughout the years. When I arrived here in the mid-1980s, it was a very different community. There was a lot of I don't want to say stratification, but there was stratification amongst groups, amongst health insurers, and the primary means of accessing healthcare, if you didn't have private insurance, was Medi-Cal. As time progressed, many in forums like this, we talked about health policy, and the concept of a county organized health system came into play, and that's where SenCal Health came in. And we joined the Santa Barbara Health Initiative about 13 years ago, and now all of Medi-Cal is administered through these county organized systems, and it's been really phenomenally better than it has been. And the biggest impediment that we've seen with a lot of this healthcare financing, incidentally, SenCal is the largest financier or health plan in San Luis Obispo County, but we've seen an improvement in access because of that. That's threatened. That's threatened now. Prop 35, you remember that? It seems like a century ago, but just last November, the citizens of the state of California passed Prop 35 by about 60% in all California counties except one. And what that was is it secured healthcare funding, tried to remove it from the budget process, and money that's designated from the feds that is designated for healthcare, we wanted it to stay in healthcare. And the electorate said, that's a good idea. It was a bipartisan victory. It was endorsed by both political parties, Republican and Democrat. And, you know, we learned something from that. And I hope Sacramento will learn something from that. People care about Medicaid. They care about the fact that the people who are most vulnerable need to get health care. Because one of the things that is unique about the Central Coast is that we are the canary in the cage, so to speak. It's going to happen here before it happens in the larger areas, and we need to be cognizant of that. And I remember a time when it was hard for people to get health care because they didn't have access to financing. I can tell you anecdotes, but I don't have the time for that. But people would delay care for their children who were ill because they had no means of financing that. And guess what? Guess where they end up? They ended up in the intensive care unit or worse. And I don't want us to go back to that time. I think we're better than that. I really, really do. In terms of what the future holds for us, it's hard to say, but I'm still optimistic. I want to, because I think Californians can find a way. And I'm not going to go yet into what I think we should do. I think I'll let my other panelists address these sorts of things. But right now, I think we face one of the great battles for protecting the safety net. And that's what I call it, the safety net, because we're still a people in a community that should not let people die or be injured unnecessarily. We have the means, we have to find it. I do want to recognize there's some really important people in this conversation in this room now. CHCC, Community Health Centers for the Central Coast. Steve Clark is the medical director there. So, you know, before there was CenCal, years and years ago, it's got to be, 40 years that you guys have been around? They were seeing the kids on Medi-Cal when no one else would. And I salute you because they have they've persisted in their journey. And the hospitals, Sue, I see Sue over there, you know, from Dignity. These people are committed to making sure that this works. And I haven't even touched on Medicare. That's a different one entirely, but it's another problem that we have here. We have to create an environment where we can retain physicians. And so far, it's tough. It's really tough. There's more of us retiring than coming in here. And so we need to address that also. But I just want to say that, you know, public policy has always been an issue of battles and discussion. And I think that we need to come together. Doesn't matter whether you're an R or D, come together right now, because we cannot let the most vulnerable populations suffer unnecessarily, because if they go, if our system will collapse. And why do I say that? Because people will still go to the hospital if they're an extremist, but will we be able to keep those costs? Well, it could sink the ship. And I know a lot of the hospitals are very worried about this right now, as well as a lot of the providers. And so I'm going to stop right here because I can go an hour on this. But anyhow, thank you for letting me be here.
Thank you, Dr. Bravo. Dr. Nazmi, do you have a prepared comment, or would you like a question that they gave me to ask you?
I don't have anything prepared, but the danger in inviting a university professor on a panel.
Well, I have a timer here with a stop sign we could always use.
Just, you know, in listening to Dr. Bravo speak, and we're here to talk about health care. And experiences with healthcare are very intimate. They affect all of us, and they affect us in very vulnerable moments of our lives. You got it. I'm an epidemiologist, and we do public health. Healthcare is where you go when you need attention for a problem. In public health, we try to look at the structures and the systems and the policies that lead to that health, that state of health. So I just don't want that to get lost in the conversation. Healthcare availability in the Central Coast is low. Show of hands who has had problems with availability or accessibility of healthcare. All of us. You ever tried to get your teeth cleaned? availability is a problem of healthcare, 100%. But as Dr. Bravo was alluding to, healthcare is not the only tool in our toolbox to address health and health states among our population. And that conversation, by definition, then expands into things that you all know: housing, jobs, education, economy, etc. So in the conversation of healthcare, it is critically important to talk about things like healthcare providers, insurance, state and federal policy, of course. But I think we shouldn't lose sight of the forces that drive health. And those forces are all around us. And those forces, I think, play really important roles in determining who needs healthcare, when, where they go, whether there's availability or access to that healthcare. So that wasn't prepared, but I would really like that to be part of our discussion and our thinking when we're thinking about healthcare. What are those forces that drive health? They are not just biological processes, and they don't only have to do with one patient and one physician. What affects my health affects your health. If my neighbor is healthier, then I am healthier for it. So the benefits of keeping entire populations healthy through larger policies and systems and structures should be a key part of why we're here today and the things that we're discussing.
Thank you. Okay, I've got we're going in a new direction here, folks. Okay. There was a lot of people that asked, and this is anybody can answer. Okay, we won't direct it to one particular panelist, but what can we do to get a big player like Kaiser to come here? They would bring primary care and help with access.
I'll take that. That's been a common question that I've been asked, is when is Kaiser going to get here? And what does that mean? Kaiser Permanente is an HMO model that is probably the oldest and one of the largest in the country. The problem is, quite frankly, we're pretty small. We're a small market, and the amount of people that would have to exist within a market to make that a system that would work does not exist here. And we've had relatively, our population growth is not really elevated to that point. So what would it take? It probably would take an infusion of a couple of 100,000 more people. So, and I'm not sure people are running to that solution quickly, because then you have other problems. Where do you put them? How much water do you get them, et cetera, et cetera. So.
Thank you. Anybody else want to comment on Kaiser? All right, we'll move on to the next question. This has been going on for years and years, but why can't our area be changed from rural and Medicare billing to urban for our physicians? Because the reimbursement rate is so much lower, but the cost of providing services is extremely high.
Let me take that one again. Okay.
This is why they elected him first president of CMA from San Luis Obispo.
The problem we're dealing with here is the Medicare designation. You know, Medicare as a region is California, and everything has to be kind of budget neutral. So if you give more to one region, you're going to have to take away from another region. And whether we're designated rural or urban or whatever, the fact is the entire Medicare payment system is really woefully fractured right now. I mean, physician reimbursement rates, for example, have decreased 33% over the past 20 years or so. And even this year, their Medicare said in their great wisdom in Washington, we're going to cut you again. And so what does that do to primary care or to the specialists? It doesn't incentivize them to participate in the Medicare program, and that's a problem. That's a real problem here. When I turned 65, I tried to find a physician here, a primary care physician. I thought it was going to be easy, bounce your name around a little bit. That didn't work. And, I couldn't. I had to, and finally I did, but I realized at that moment, because people weren't saying, no, we couldn't see you. We have already our quota of Medicare patients, and we don't have any room. If I couldn't find a physician, and I've been here 40 years, imagine what people out there are going through. So essentially, changing the rural designation to urban will not necessarily increase the reimbursement anymore. And no one's really going to believe that we're urban, really. I mean, it's beautiful here. You know, I don't want to change that, but anyhow, that would be a very simple answer for a very complicated question.
Anyone else want to add to Dr. Bravo's comments? Okay. So I think Dr. Nazmi addressed this to a certain extent, but this is the question that's been asked the most. What else can be done to encourage more doctors to move to our county? We've lost so many specialists. As Dr. Bravo said, we have more retiring than incoming. How can we attract more qualified medical professionals?
As Dr. Bravo said, all these questions are very complicated, but that's a good one. And I want to shout out to the Healthcare Workforce Development Partnership of SLO County. This is a partnership that was initiated in 2023. It's a bit of a mouthful. Did you get that? The SLO Healthcare Workforce Development Partnership. This is about 45 individuals representing about 18, 19 organizations across the county, the healthcare folks, education, insurers, hospitals, etc. And our singular goal is addressing this question. How do we improve the healthcare workforce in the county? Not an easy response. And the first answer that comes to my mind is together. On the partnership, there are 3 subcommittees, one of them for recruitment and retention, one of them for funding, one of them for education and career pathways. I'm a professor at Cal Poly, so I'm helping with the career pathway subcommittee. And one of the opportunities I think that we have is educating folks that live here, work here, study here, upskilling them, reskilling them, having opportunities to get degrees, certificates, and enter the healthcare workforce, whether they're already in the workforce and want to upskill, or whether they're students or young people here and want to enter the workforce. Cal Poly has a new initiative called the Allied Health Initiative, whereby we are exploring ways to increase our healthcare professions portfolio. Some of you guys may be familiar with Cal Poly's opportunities in healthcare workforce, and it's not much. Cuesta has a number of programs. Frankly, they do a lot more than we do. So does Allen Hancock College. Cal Poly has a long way to go in joining the ranks of producing more healthcare workers. We are the only four-year university in a 100-mile radius, only CSU in about a 120-mile radius. It is up to us. So for any of you with links to Cal Poly, I would suggest you talk to your folks at Cal Poly and say, hey, I heard Cal Poly's doing this thing. What's come of it? So educating our Central Coast residents, our Central Coast students, I think is a really big one. For every one physician, there are 20 allied health workers. For every one physician, there are 20 allied health workers. Nurses, counselors, therapists, lab scientists, etc. Cal Poly is not going to be training physicians anytime soon, but we can certainly help train the 20. In the Healthcare Workforce Development Partnership, we also talk about things like recruitment and retention, as Dr. Bravo was mentioning. It's hard to get physicians here. And we were talking just before the panel, who stays here? Who are the physicians and who are the primary care, who are the providers that stay here? And the answer is people who have a compelling reason to be here. Maybe they're from here. Maybe they studied here and they want to come back here. What are those incentives we can provide those folks to stay here, besides the obvious, which is salary?
Thank you for that. Assemblymember Addis wanted to add some information to this as well.
Yeah, I'll just, the state of California has made a number of gains and put a lot of effort into this. And it's one of the things that we are trying to protect as we go through budget negotiations. And so, one of the things that we know, and I think the two doctors here will support, is that often where folks do their residencies is where they end up staying. and practicing as doctors. And so California has what's called the Song Brown initiative, which funds medical residencies in underserved areas in California. We also have Prop 56, which is what you may know as the tobacco tax, which has a fund within that for loan repayment for doctors. And so trying to help those coming into the field who now may be coming out of medical school with $400,000 in debt. We used to say, oh, doctors will come out with $250,000 in debt. Now we're looking at $400,000 in debt for many doctors. And so those residencies and that loan repayment is critically important. Dr. Bravo mentioned Prop 35, which the voters of San Luis Obispo supported at 68%. 68% of the voters in our county and across California said that we want this particular tax to go specifically towards raising rates for providers. And so we are right now in negotiations with the governor, who is trying to roll back some of those gains. And I'm a champion of our governor, but in this situation, he has really attacked provider rates, and it's something that we are fighting for. And it's something I will also mention that Prop 35 has been important for not just doctors, but dentists, Planned Parenthood, the entire hospital system, to make sure that providers can be attracted to our area. I will also say that we have heard in the legislature from a number of folks that say the workload for doctors is sometimes unbearable and that they need help. And we've seen a number of organizations now start to dabble in or invest in artificial intelligence as one of those tools. And so we just had a hearing between the Health Committee and the Privacy Committee to talk about the use of artificial intelligence in the healthcare system and where it can benefit, but where we need to be concerned and where we need to put on guardrails. And so it's a very new but robust conversation that is happening. And I encourage you all to sort of start thinking about when you go to the doctor and or the hospital or any healthcare setting, and how AI is being used there and protecting your patient data and your privacy. The last thing I'll say is that California this year in the legislature under Speaker Rivas, we have decided that affordability is our number one priority. And so every piece of legislation that came forward this year was looked at through the lens of, will this increase of affordability for Californians, or will it decrease affordability for Californians? And so we just went through a process called appropriations, where bills live or die before they go to the floor for a full vote. And we lost, as a legislature, we lost about a third of our bills, myself included. And primarily that was around affordability and putting this lens on legislation. Is it going to help? And we know that we struggle with affordability, with having the right kind of housing for the Central Coast and with cost of living. And so we are also working to bring cost of living down, whether that's through utility rates or bringing down other kinds of costs in our system. And so we are, as a broad body, trying to work on the issues that will help San Luis Obispo, but we're also needing to lift up the voice of San Luis Obispo and the Central Coast specifically. And so you heard in my bio that we have a Central Coast Legislative Caucus that I co-chair with Assemblymember Hart, who is in Santa Barbara and southern San Luis Obispo County. And we have been working to coalesce. It's the very first time we have a formalized group of legislators who can advocate for Central Coast issues, one of them being the cost of medical costs, as well as medical access here, healthcare access here.
Thank you. There were a lot of people that asked this question: why does California continue to cover undocumented immigrants?
Yeah. Boy, in policy circles, I always notice that the room gets really quiet when that question is asked. And I'm going to answer that like a physician, and this is really important. Physicians, we are not arbiters of we're not, what do they call it now? We're not ICE people, meaning that when you walk into a room, you see a sick human being, you don't ask where they're from, you don't ask their status, you just treat them. And we're never going to be, and we're not going to be people that enforce that. And so when someone comes into your office and they have no way of paying for that health care, that cost is passed on somewhere else. One of the things that California did in providing that, and we had a lot of debates, I had lots of discussions with our former legislators here about the whole concept of making sure that everyone was covered, because in the long run, the studies have shown that it decreases the cost of healthcare if everyone has some access. It's logical, but it's not emotionally logical for people. So I would say it's a challenge. I know that Sacramento is struggling with that right now, and it's a big question. And I know all of the answers are tenuous, but I would say this as a physician. We are not agents, immigration agents. We see people regardless of their immigration status, especially children. And I know that in my career, I've seen a lot of children who would fall under that category, and you know, they just need to get what they need to get, or else is something that's unthinkable. So,
would any of the other panelists like to comment?
Similar to Dr. Bravo, the first thing that pops up into my mind is the answer is because they're human.
I'll add on a little bit around the fiscal responsibility around giving healthcare to everyone, making sure that everybody has access to healthcare. And I started out by saying California should be very proud. We have 94% coverage. 94% of the people in California have access to healthcare coverage, which is historic in nature for California, but is actually that we're a leader across the United States in doing this. But undocumented people, we have had great debates, really intense debates in the state legislature, particularly this year, around the cost of undocumented care. And one of the data points that came out of those conversations is that undocumented people pay $9 billion in taxes into the California economy. $9 billion. And the cost of undocumented care is around $9 billion. And so when people say, why do those people get care? Well, those people are paying for that care with their tax dollars. It's coming into our system. So that's one piece of the puzzle, is there is a real financial piece to this. The program itself in California is paid out of what's called the general fund. It's about 6% of our Medi-Cal budget. But we talk a little bit as well about the cost of uncompensated care. So if folks can't get preventative care, then they have care that they need nonetheless, and they end up in the emergency room. And there's a real cost to that. It's a financial cost, but it's also a cost for all of us when it comes to access. Because if emergency rooms are clogged with people who could have been getting primary care, then when a real emergency happens, we will have longer wait times, and it will be detrimental to our system in general. The last thing I'll say about that is, if we take those dollars out of the system, we may start to see clinics that can no longer survive. Public hospitals, we don't really have many public hospitals on the Central Coast, but public hospitals that will no longer be able to pay their bills and keep their lights on, and we will lose access for the community as a whole. And so the real human reason to do this is super, super clear, but there's also a financial and an access issue for all of us that is very real.
Thank you for that. Well, speaking of closing clinics, this question comes from the audience. SLO County Health Department is closing the reproductive clinic in North Paso Robles. Will other clinics in SLO County suffer a similar fate?
Yeah,
that.
yeah. I can't speak specifically to the North County Clinic. What I can say is that this this Congress stopped what's called Title X funding for family planning. And so typically when there's a change from Democrats to Republicans, Republicans often cut what's called Title X funding, which is funding for family planning. It's not funding for abortion care, but it is funding for these clinics. What happened this time, though, is the funding was stopped without notice. And there's a whole bunch of other ripple effects that are happening in Congress with funding freezes. We saw recently for public health, you may have heard the headlines that the federal government stopped $11 billion going into what they said was COVID funding. And these were funds that had been appropriated during COVID, had been sort of reformatted to use in the public health system. And overnight, $11 billion was gone nationally from public health. $1 billion was gone for California. So hundreds and hundreds of jobs, as well as grave effects across California. We had a hearing on this, on the effects of cutting the public health funding, and had a public health officer come from Sacramento, and she talked about potential measles outbreak. They had 3 different patients with measles, unrelated to each other. They had touched, had an effect on 200 folks. They had to contract trace for 200 folks. It was that portion of money, that what they were calling COVID money, that was frozen, that had paid for that. And so she came to the hearing and said, we're not really sure how we're going to respond to that. It's also happening on the family planning side with the freezing of funding in Congress. And we work very closely with Planned Parenthood. We're very fortunate in San Luis Obispo County that we have a Planned Parenthood that is providing care, family planning care, abortion care, other kinds of care to people in need, but they are affected as well. And so it's one of the things that we are trying to protect. I mentioned Proposition 56, the tobacco tax. Some of that money is also family planning money. And so the governor has said he's not funding Prop 56 tobacco tax from the general fund. We are fighting to bring that funding back so that we can preserve family planning in San Luis Obispo County.
Okay.
And we have a director here who says they are.
Another question from the audience, and it's to the whole panel. If they add an employment requirement for Medicaid recipients, what is the earliest date that this could take effect?
Say this again.
If they add an employment requirement for Medicaid, when
2027, wasn't it?
I would just say it's so erratic and dysfunctional in Congress that it's very hard to know exactly when anything will happen. I think the doctor was just saying we think 2027 if that were to happen, but it's really hard to tell what the Senate is going to do, right? So the House passed it. We're waiting to see what the Senate does, but it's very hard to know what they're going to do.
I may add that even though it's been passed by the House, it goes to the Senate, there is still time to voice your opinion. Even if your legislator votes with or is with us on these issues, they need to get the volume out there, because they go to the leadership and they say, hey, this is the number of calls we got. We got to change this. We got to do something about this. And back to the issue of health, of manpower shortage or people power shortage or whatever you call it these days. The problem is difficult because you cannot produce a healthcare provider in 9 months, a year, especially physicians. It takes years and years to get them through the pipeline. And we are doing some positive things in this community that did not exist in 40 years when I got here. There is a couple of residency programs in Santa Maria now for family medicine and for OBGYN. There is a PA school now that's opened also in the Santa Maria Valley. That the problem they have is finding sites locally to train, and that's always been an issue. But those are positive things that I did not see happening. residency programs bring in graduated physicians and train them. Santa Barbara has a residency program. Ventura does too. Salinas, we don't. Part of the reason why is you have to have volume, and so if there isn't the care here, you're not going to be able to see enough people to make that happen. But that's another reason why we have to preserve the safety net, because I think residency programs are a way to increase the provider base here in this county. And I think it can be done. The other thing too, we alluded to the fact that the educational process was so expensive, and people come out of medical school with such incredibly high debt. Well, that is a detriment, because those kids who come from underserved backgrounds are the most likely to serve those populations, are really going to have a hard time in areas like this, because they won't. And so that's why the urban areas and the more desirable areas seem to get them first. So we need to address the student debt issue. Without doing that, we're not really going to change a whole lot. And so, and one of the, what was debated whether I should say this publicly or not. So
go for it.
We are live streaming. I know it can't be pulled back. This is not policy of the California Medical Association, but it's something that I've wondered for years, just as Renee Bravo, citizen speaking. If all of our members in the state Senate and the Assembly and the governor himself insured their families under Medi-Cal, they all took it, I wonder if we would have these issues, And I really say that because it really just wears on me that we have to debate the funding of healthcare for vulnerable populations at levels which are really not sustainable to the private industry. And then the other part of this is health insurance. That's why I ran for the Assembly 25 years ago. I've recovered from that. But I would tell you the health insurance industry itself, private health insurance, the way they finance it and the schemes that they put up to keep care from happening are insufferable. They're just insufferable. Our Assembly member here has introduced bills to help deal with that, prior authorization reform, for example. And see, that's part of the landscape that we're dealing with. So it's not just Medicaid. We've got to deal with the private health plans. The private health plans have a responsibility to help solve this problem, not just to deny care. And that's where we've got to be careful with AI, because AI is fine. It's good. It helps you write poems and term papers, but it shouldn't override a physician's judgment on dealing with your health care. And so all these are big factors here, not only in the state or the nation, but here locally we deal with that. So anyhow, I've got that off my chest. That was not public policy. That was just personal. I feel better now. So.
Would any of the other panelists like to comment? So there's only 5 minutes left, and I've been told that that's your 5 minutes to wrap things up. Can I take a leap here and say we have a number of questions we didn't have time to ask, and I'll get them to your office. You want one more? Okay, here we go.
I think people heard enough of my speeches, so let's do one more, if we can fit one more in.
Dr. Nazmi referenced whole community health. Can you please talk about the ways that food access impacts community health? Cuts to SNAP, CalFresh, etc. will impact the same people who are impacted by all the other Medicare and Medi-Cal cuts.
We've talked a lot about public health, and all the studies show about $1 investment in public health yields about $15 return. It's one of the smartest investments that local, state, and federal governments can make. $1 in, $15 out. Almost every other middle and high-income country in the world has already figured this out, not least of which by offering universal care systems. And universal care systems, yes. Universal care systems are usually paired with really strong public health infrastructure so that the medical system, the health care system, is not overwhelmed. So if you have a healthy populace, they don't go to the doctor as often. They don't need as much care. They don't need as much drugs, etc. And food is something we all need. The question of SNAP and SNAP Ed California, we call it CalFresh and CalFresh Healthy Living. In the current federal administration are in the crosshairs. SNAP, if you're not familiar, called CalFresh in California, puts money in the pockets of folks who need it for groceries. I don't remember what the question was.
I thought that happens to me.
It's just the ways in which not having access to food impacts the community as a whole and those most at risk.
Are you guys familiar with the term hangry? You ever get hangry? And what if you're hangry for weeks or months at a time? You think your health suffers? What if you're not living under optimal conditions? What if you're living somewhere that is polluted, the air is polluted, or the roof leaks, or the water's not running, or the toilet's not flushing? This is all public health infrastructure, and food is one of those key public health infrastructures that I think we tend to overlook because we separate things like food and housing from health, however, we know that they're all integral to one another. Central Coast of California and California, as you know, produces something like 70 to 80% of all of the fresh produce in the United States. And we have some of the most food insecure populations in the United States. I cannot reconcile those two in my mind. I don't know how the people picking the produce cannot afford the produce they are picking in the store, but this is the situation in which we are. So the question is, how do we make access to food, in my opinion, a human right, not a human privilege? How do we overcome that in California? Are we not thinking big enough? Are we not thinking big enough in the state of California, fourth largest economy on the planet? I propose we're not thinking big enough. Universal food access, housing, health, public health infrastructure, these are all things that are quite tackleable. These are things that other countries and other jurisdictions around the world have done. And for some reason, not least of which our friends in the health insurance, I like the word Dr. Bravo used, scheme industry, these are things I think to overcome. And I think the only way to overcome them is the way that other countries have done them. And that is by people power. So the question is, how do we generate enough people power to make those voices so loud, so undeniably loud and undeniably clear that folks in Sacramento and DC cannot refute these basic human needs that we have?
Thank you for that.
Yeah, very good.
Dr. Bravo, would you like to have a 1-minute closing comment?
I just want to go back to my first statement. This is a very human issue because it affects most of us, and I would venture to say that all of us in this room know someone who's on Medi-Cal, or know someone who is struggling to find a physician or get services on Medicare. So these are very personal issues for all of us. The second part I want to say is that those of us are in the advocacy groups, in healthcare, in public policy, we're working really hard right now. I call it the Super Bowl moment, because we have never seen the types of threats or things that I thought were unimaginable 7 months ago. So, and the third thing is never lose hope. Never lose hope. Never lose hope. Because you have a voice, you can use that voice, and please do. For your families, for your neighbors, and for the community. Thank you.
Assemblymember Addis.
Well, I want to touch a little bit on what Dr. Nazmi said around thinking bigger and what we can do around housing and around food. And so California has put quite a bit of effort into getting what are called Medi-Cal waivers so that we could use Medi-Cal dollars for the social determinants of health, for things like emergency housing vouchers or emergency housing money. This year we had a bill that one of our chairs brought forward to be able to get a Medi-Cal waiver to use Medi-Cal dollars for rental assistance, longer-term wraparound rental assistance, knowing that if somebody becomes unhoused, obviously their health needs shoot up and the price of uncompensated care will go incredibly high, or the price of not having a home the price on your health is incredibly high. We also had a program called Food is Medicine, so that we had Medi-Cal waivers to be able to use Medi-Cal dollars to pay for food that people needed due to their health condition. All of that is under threat at the moment because of what is happening at the federal level, because Medicaid is under attack at the federal level. With the work requirements, California stands to lose billions and billions of dollars. And so somebody asked a question around work requirements that basically is that people have to verify that they're working, which causes another barrier to be able to get Medi-Cal. And so people start to drop off the rolls. The purpose of those policies is not to verify that people are putting in the effort. The purpose is to get to people to drop off the rolls so that they don't have health care, so that we're not paying for health care. And California will lose billions and billions of dollars, and probably will not be able to make up the difference. But so we have tried to make gains in those areas around social determinants of health, and we're still working on it. We passed in California, we talked about how do we get more people to the Central Coast, and Dr. Nazmi mentioned, or Dr. Bravo mentioned, the allied workforce. We passed in California the $25 minimum wage for nurses and other healthcare providers, non-doctors. I was one of the first co-authors of that bill to try to raise the boat, right, for all people, because one of the things we really don't want is the very people providing healthcare, and we've heard this, the very people providing healthcare, they themselves are unable to afford housing, or unable to afford food, or unable to afford those things that will keep them healthy. So we have made a lot of progress in California. We are facing our own budget challenges, but the real issue is what's going on with Medicaid. And I would just concur with my fellow panelists that using your voice is the most important thing that you can do, to go back home and tell 5 friends. And of course, you have allies in Congress that you're going to be contacting with Carbajal and Panetta, but to keep telling your friends in other areas as well how important this moment is for all of us. And with that, I just want to say a deep thank you for attending our very first town hall style event. You're all wonderful. It's wonderful to have had you here. And please do follow up with our office. I know there's a couple questions that didn't get answered, but we would love to hear from you.
Thank you for attending. You were a very thoughtful audience, and we really appreciate that, as do the panelists.